Welcome back, everybody. Thank you for joining us for the next episode of Unfiltered Emotions. I am Kairi, a Humanity Rising ambassador and one of your co hosts.
And I'm Ellen, one of your other co-hosts. So, Unfiltered Emotions is a mental health podcast co-hosted by Humanity Rising ambassadors Kairi Harness, Nora Chiew, and Ellen Hsuan, and featuring Dr. Michelle Magida. Dr. Magida founded Therapy Etc., a wellness clinic in Buffalo Grove, Illinois, that provides mental health support through individual and family therapy, psychiatric care, educational advocacy, and tutoring and mentorship services. Dr. Magida, it's a pleasure to have you again.
I'm really excited to be here.
And together we will speak on topics such as anxiety, depression, suicide ideation, and the steps we can take to improve our mental well being and much more. So, without further ado, today's topic is um, anxiety and depression. I'd like to start by asking Dr. Magida to share why this topic is so important. And the terms depression and anxiety get used a lot. So could you explain what those are, some signs and symptoms that teens should be aware of for those?
Yeah. I think that this is a really important topic to talk about. Um, Depression and anxiety are terms that get tossed and used a lot. And it's important to understand the differences between symptoms of something, and then like a full blown out diagnosable condition. So the terms depression, anxiety get used a lot. And depression is a very common mental health disorder that causes people to experience depressed mood, loss of interest or pleasure in things that were, previously really important to them, feelings of guilt or low self-worth. And we talked about that in a previous episode when we talked about suicidal ideation. Um, Disturbed sleep or appetite, low energy, poor concentration. And so depression in and of itself is a very serious mood disorder. People with depression feel anger, helplessness, sadness, and these things really interfere with their everyday life. People tend to confuse sadness with depression, and because they're both have a lot of commonalities, right? A lot of overlap, but they're not the same thing because sadness is temporary, something that can subside, usually over time. But depression, it's constant. It's this constant, persistent feeling of self-loathing and hopelessness, right? Whereas anxiety, um, also extremely common, but it's more than just a temporary worry or a temporary fear, right? For a person with an anxiety disorder, that those feelings just don't go away. And as a matter of fact, they can even get worse over time. And anxiety can be really confusing. You could feel fine 1 minute, and then the next, you have all these physical symptoms that can just come out of nowhere. And these physical symptoms can feel really serious and really scary. Um, Also, like we talked about with suicidal ideation, just the thought of it can be really scary. And individuals that struggle or suffer from anxiety can find themselves experiencing anticipatory anxiety or anticipation anxiety just at the thought of a normal task, like taking a shower, doing your homework. And it can be really hard to describe how your anxiety is making you feel. It can be really hard to put into words with family, with friends, with adults. And you can find yourself questioning everything, right? Um, from how a future event may unfold, or questioning things based on the slight changes in someone's tone of voice. So common signs of anxiety are feelings of restlessness or feeling really wound up, difficulty concentrating or your mind just drawing a complete blank, consistent or chronic muscle tension or tightness. Some people might even have muscle tension issues like TMJ, sleep problems, can't fall asleep, can't stay asleep, or you don't have good quality sleep, so you're often really tired. Um, Irritable, annoyed, angry, which you can imagine if you're tired kind of goes hand in hand, right?
Yeah.
Um, but really, individuals with anxiety really struggle controlling their feelings of worry. And another really common symptom with anxiety is frequent digestive problems or headaches. I know that was
Thank
a
you.
lot.
All good. I think it's really interesting that we're able to discern between like the medical terms of depression and anxiety versus the symptoms, which can be a little jumbled at times. But if those two like disorders are so common, what are some possible triggers of these symptoms and like why does it happen?
So it can happen for a number of reasons. Abuse, right? And there is physical abuse, mental emotional abuse, sexual abuse, physical abuse, hormone issues. For females, puberty can be a huge trigger. Thyroid issues, issues pertaining to your menstruation cycle for individuals born female, um, medication side effects, conflicts in interpersonal relationships, major life events like death, divorce, moving, substance abuse. You can have depression and anxiety as a side effect of abusing substances, accidents, health issues, um, nat natural disasters. Those are, that's why it's so common, right? Because so many different things can cause it.
Yeah. My family actually has a lot of anxiety disorders and depressive disorders, and I myself don't have those, but I have the conditions where you're at higher risk of them. Like I have fibromyalgia, so they're constantly checking me for depression, and I'm in therapy to make sure I don't fall into that again. And I was majorly depressed when I was on birth control. That normal thing that some people deal with on hormonal birth controls is you just get depressed. I didn't even know I was depressed until like my mom had said, "Hey, you're being different."
Yes, and that's why it is so important to notice changes in your body and talk to the adults in your life and your doctors and stuff like that. Sometimes with birth control, you need the same dose throughout the whole month instead of some birth controls have different doses of estrogen each week leading up to the period. So sometimes it's not the fact that you're on a medication, it might be the type of medication that you're on.
Right. Um, And I have a question about like the related nature of these two disorders. So can they overlap with each other? Can you have depression and anxiety at the same time? And does it kind of affect each other?
Yes, absolutely. Um, it can overlap. It can happen at the same time. Actually, according to NAMI, the National Alliance on Mental Illness, an estimated 60% of individuals with anxiety also have symptoms of depression. And the numbers are pretty similar for those with depression that are experiencing anxiety. Um, so you can have both things at the same time. Um, Working with a therapist can help you understand if for you individually, it's your anxiety that's leading to depression, or if your depression is leading to anxiety when you do have both.
Yeah, and going off of that, when should you see a therapist for it? When should you seek help for if you have symptoms of anxiety or symptoms of depression? When should you start saying, hey, there might be something like wrong?
I think that when I mentioned earlier the difference between symptoms of and then a full-blown diagnosis meeting the criteria for an actual
Mhm.
disorder, I think that's where it's really, really important to highlight that difference. You do not need to meet the criteria for a full-blown disorder in order to be worthy of help, or you don't have to wait to a certain point to get help. As soon as you are noticing symptoms of, who likes being irritable? Who likes having sleep problems, right? Or headaches or restlessness or losing interest in stuff, right? If you're feeling any of these things, get help. It's okay to get help.
Yeah, I therapy is amazing, and I know that me personally, who has symptoms of but not an actual diagnosable depression, like I have horrible quality sleep, I don't sleep for very long. I think just today I probably got like 4 hours, maybe 3 hours of sleep. And that's just my normal for me, not something that like anyone is particularly worried about. But I know that going and see my therapist and talking about it does relieve a lot of the stress I have. And I do know those days, like when I have get horrible sleep, I'm more likely to be stressed out about things that I'm not normally worrying about. I definitely it makes it harder to sleep the next night. It's a cycle.
It absolutely is. Yeah. And I love that you're talking about recognizing family patterns, family history, and you having a higher likelihood for developing certain things because of that family history. That's called a predisposition, predisposed to something, right? So, like if you have heart disease in your family, you could be predisposed to heart disease, and there are certain steps that you should take in monitoring your heart health and wellness, right? And similarly, if you have a family history of any mental health disorder, then you are predisposed to that, and taking those preventative maintenance type steps can be super duper helpful, right? You do not need to wait to have a problem to get support.
Yeah, being proactive rather than reactive about your health.
Yep.
Yep, those are some really good pieces of advice. I think I also agree that it's really helpful to kind of seek help like ahead of time before like maybe the symptoms get really serious because that can kind of alleviate um, some of the the darker or like the worse effects of
Yeah.
anxiety and depression, right? So I know that both of you mentioned like attending therapy and just talking about it has been really helpful. But I wanted to ask about like some other treatment options. Are there medications that can help? Like after going to like a doctor, are there any like breathing exercises or other kind of mindfulness exercises that you can take that you can use so that like these symptoms can be relieved.
Yes, absolutely. So there are a lot of different treatment options for supporting anybody that is experiencing anxiety, depression, or symptoms of talk therapy, medication, support groups, breathing exercises, which I'll talk a little bit more about, socialization, right? Not isolating yourself, regular exercise, and a healthy food and sleep diet. Um, So I do not like leaning on medication I think that medication is a beautiful tool. And I think that in conjunction with lifestyle changes, and additional supports such as um, talk therapy or support groups, medication can be a really, really helpful tool. It should not be used as a crutch, right? I'm feeling symptoms of anxiety. I'm gonna go talk to my pediatrician or general practitioner. They're gonna put me on Zoloft, and then all of a sudden, miraculously, I'm gonna feel better. That's not actually how it works. Um, which people want it to work that way because we're conditioned to believe that that's how medicine works. When we don't feel good and we go to the doctor, we have strep throat, we take antibiotics, we see marginal improvement quickly. As a matter of fact, if you're not seeing improvement in 3 to 5 days, they say come back, right? So, but mental health doesn't work that way. You can't just take a pill and then it gets better. Medication helps make it less intense, for sure. But it's not like a miracle, a magic wand. Breathing exercises and just mindfulness exercises. We do have deep breathing. We have progressive muscle relaxation. We have meditation. We have imagery and visualization, which are sound really hokey, but honestly, imagery is a very, very powerful, powerful tool. So, those are just different things and steps that you can do to help manage anxiety and depression and to treat it.
Yeah, once again, I can hit the bubble of I'm also on antidepressants. But I know that I don't ever want to think of it as I need this in my life. I need to have my antidepressant or I'm not going to be as happy as I am. I realized I was doing that the other day and I actively stopped myself and said, "Hey, I don't want to think of this as I need to be on an antidepressant to feel better." And I actively said it's to help, not to solve my problems. And I feel like that's a really good mindful thing to remember is it's to help, not to solve it when it comes to mental health medications.
I agree. It is to help, not to solve. At the same time, some people do need it.
Hmm.
Some people with certain mental health disorders, they need medication in order to be okay. Their chemical makeup or trauma history or life circumstances make it so that is what they need.
Yeah.
And that is okay too. It is okay to need medication, just like it is okay for an individual with diabetes to need insulin.
Yeah. It's perfectly fine to be on medication for your whole life. I have family who's on medication for their whole life. It's
Totally.
acceptable and you shouldn't ever think less of yourself or others for having to need that in their life.
Yep.
I think that it's important to kind of realize that I guess I'm thinking that depression and anxiety can manifest in different ways in different people, right? It's not just like the same symptoms for everybody. And I think
Yes.
like kind of spreading the word about that can be really helpful just from a perspective level because like what somebody else is experiencing might not be like the same as yours. They can be more mild, they can be more severe. And I think it's just important to remember that like our bodies and our minds just operate differently, right?
Yes. Yes. You can have 5 different people with ADHD, with autism, with depression, with anxiety, and they can all present very, very differently. Um, there are so many different things that play a role into that. your experiences, right? Your gender, your age. Like there's just so many different things. So you are absolutely right. We're never going to compare. It is unfair to compare.
Right. Well, Dr. Magida, thank you so much for joining us and for your passion to help youth enhance their mental health and overall well-being.
Thank you so much. I really enjoy sharing this knowledge with you, and I hope that this information helps even one person make a difference.
Yep. And also thank you, listeners. If you have a topic or question you'd like us to cover, please feel free to email us at students@humanityrising.org. Join us next time as we continue exploring more unfiltered emotions. See you soon. Thank you.